doesn't make any sense. We wear masks in an acute setting to protect us. We're not wearing masks. Why is that? Because we understand microbiology, we understand immunology, and we want strong immune systems. Our immune system is used to touching. We share bacteria, staphylococcal, streptococcal bacteria, viruses. We develop an immune response daily to this stuff. When you take that away from me, my immune system drops. As I shelter in place, my immune system drops. You keep me there for months, it drops more. And now I'm at home, hand washing vigorously, washing the counters, worried about things that are indeed what I need to survive.
You're not immunodeficient and you're not elderly. You should be able to go out without any gloves and without a mask. I think if you are those things, you should either shelter in place or wear a mask and gloves. I don't think everybody needs to wear a mask and gloves because it reduces your bacterial flora. It doesn't allow you to interact with society, and your bacteria flora and your viruses, your friends that protect you from other diseases, end up going away, and now you're more likely to get opportunistic infections, infections that are hoping you don't have your good bugs fighting for you, if that makes sense.
And then as we all come out of shelter in place with a lower immune system and start trading viruses, bacteria, what do you think is going to happen? Disease is going to spike.
I guarantee when we reopen, there's going to be a huge amount of illness that's going to be rampant.
The building blocks of your immune system is virus and bacteria, end of story. So if we look at California, these numbers are from yesterday. We have 33,865 COVID cases out of a total of 280,900 total tested. That's 12% of Californians were positive for COVID. So we don't, the initial, as you guys know, the initial models were woefully inaccurate. They predicted millions of cases of death, not of prevalence or incidence, but death. That is not materializing. What is materializing in the state of California is 12% positives. Well, if we have 39.5 million people. If we just take a basic calculation and extrapolate that out, that equates to about 4.7 million cases throughout the state of California, which means this thing is widespread. That's the good news. We've seen 1,227 deaths in the state of California with a possible incidence or prevalence of 4.7 million. That means you have a 0.03 chance of dying from COVID-19 in the state of California. 0.03 chance of dying from COVID in the state of California. Does that necessitate sheltering in place? Does that necessitate shutting down medical systems? Does that necessitate people being out of work? So if this is a typical extrapolation, 328 million people times 19.6 is 64 million. That's a significant amount of people with COVID. It's similar to the flu. If you study the numbers in 2017 and 2018, we had 50 to 60 million with the flu. And we had a similar death rate. The deaths in the United States were 43,545. Similar to the flu of 2017, 2018. We always have between 37 and 60,000 deaths in the United States every single year. No pandemic talk, no shelter in place, no shutting down of businesses, no sending doctors home. Severe disruption for accelerated as we have people coming in 7 in the morning till midnight. We're reporting to the health department. We're calling patients back. And at the same time, our volumes have dropped significantly. The hospitals, their ICUs are empty, essentially. And they're shutting down floors. They're furloughing patients. They're furloughing doctors. So the health system has been evacuated in certain places. In New York, the health system is working at maximum capacity. In California, we're really at a minimal capacity, getting rid of our doctors and nurses because we just don't have the volume. The hospitals don't, as I've met with our CEOs twice in the last week, and we don't as well. We're sharing our own data. This isn't data filtered through someone. This is our own data. We found 6.5%, and then California has found 12%. So the more you test, the more positives you get, the prevalence number goes up, and the death rate stays the same. So it gets smaller and smaller and smaller. And as we move through this data, what I want you to see is millions of cases, small amount of death. Millions of cases, small amount of death. Let's go over their numbers. Cases of COVID as of yesterday, 256,272 cases in New York State, not New York City, New York, the entire state. They did a total of 649,325 tests. That's 39% of New Yorkers tested positive for COVID-19. That's their ratios. This is public data online. You can all look it up.
39% of people who were tested.
39% of the people were tested.
39% of New York State.
Right.
39% of New York State is there's 20 million people there would be close to 4 million.
Which is likely, they likely have 7.5 million cases
So I
in New
just want
York.
to make that clarification. It's
Yeah.
not 39% of every New Yorker, it's every New Yorker who's been tested.
Right. So we extrapolate data.
I just want to make that.
We extrapolate data, we test people, and then we extrapolate for the entire community based on the numbers. The initial models were so inaccurate, they're not even...
But in those initial models, a lot of them were based off if we did no social distancing.
Right.
Is that correct? So is it really fair to say, obviously they're not as bad as they were because those were based on alternative scenarios?
And some of them were based on social distancing and still predicted hundreds of thousands of deaths, which has been inaccurate. So in New York, the ones they tested, they found 39% positive. So if that's indicative, and they tested 649,000 people, that's a massive test. That's accurate data, 39%. So if they tested the whole state, would we indeed have 7.5 million cases? We don't know. We will never test the entire state. So we extrapolate out. We use the data we have because it's the most accurate we have versus a predictive model that have been nowhere in the ballpark of accurate. So how many deaths do they have? 19,410 out of 19 million people, which is a 0.1% chance of dying from COVID in the state of New York. And they have a 92% recovery rate. If you are indeed diagnosed with COVID-19, 92% of you will recover. So we're seeing millions of cases, small amount of death. Millions of cases, small amount of death. When you bring up a system of lockdown, you automatically have to compare it to a system of no lockdown. Sweden and Norway. I'm Norwegian.
Norway has lockdown.
Norway has lockdown. Sweden does not have lockdown. What happened in those two countries? Are they vastly different? Did Sweden have a massive outbreak of cases? Did Norway have nothing? Let's look at the numbers. Sweden has 15,322 cases of COVID. They did 74,600 tests, which is 21%, similar to the other countries, 21% of all those tested came up positive for COVID. What's the population of Sweden? About 10.4 million. So if we extrapolate out the data, about 2 million cases of COVID in Sweden. They did a little bit of social distancing. They would wear masks and separate. They went to schools, stores were open. They were almost about their normal daily life with a little bit of social distancing. They had how many deaths? 1,765. California's had 1,220 with isolation. No isolation, 1,765. We have more people. What I'm getting at is millions of cases, very small death. Millions of cases, very small death. This is what we're seeing everywhere. Norway, its next door neighbor. This is where I come from. These are two Scandinavian nations. We can compare them as they are similar. Let's look at the data. Norway, 7,191 cases of COVID. Total COVID tests, 145,279. So they came up with 4.9% of all COVID tests were positive in Norway. Population of Norway, 5.4 million. So if we extrapolate the data as we've been doing, which is the best we can do at this point, they have about 1.3 million cases. Now their deaths as a total number were 182, fairly small, but statistically insignificant from 1,700, you realize. Millions of cases, small amount of deaths. 1,700, 100, these are statistically insignificant. So you have a 0.003 chance of death as a citizen of Norway and a 97% recovery. Their numbers are a little bit better. Does it necessitate shutdown, loss of jobs, destruction of the oil company, furloughing doctors? That's the question I have for you. And I think the answer is going to be increasingly clear as we move through this data. The next thing I wanted to talk about is the effects of COVID-19, the secondary effects. COVID-19 is one aspect of our health sector. What has it caused to have us be involved in social isolation? What does it cause that we are seeing the community respond to? Child molestation is increasing at a severe rate. We could go over multiple cases of children who have been molested due to angry family members who are intoxicated, who are home, who have no paycheck. These things last a lifetime. This isn't about a seasonal flu. These are things that will follow these people and affect them in a negative fashion for their life. And these are secondary effects from COVID. And these are from me talking to ERs, talking to my doctors, and talking to people across the country and finding out what they're seeing. Spousal abuse. We see people coming in here with black eyes and cuts on their face. It's an obvious abuse case. These are things that will affect them for a lifetime, not for a season. Alcoholism, anxiety, depression, suicide. I talked to Donnie Youngblood and various people in the community. I've asked them, how are things going? Suicide is spiking. Education has dropped off. Economic collapse. Medical industry, we're all suffering because our staff isn't here and we have no volume. These are all real things that I'm seeing every day. I don't read about this stuff. I'm seeing it in my clinics. We have clinics from Fresno to San Diego, and these things are spiking in our community. These things will affect people for a lifetime, not for a season. So let's make sure we're clear on that. Now I want to compare flu virus. Is this significantly different? And I just got a little bit of data here. So deaths, per the CDC, 24,000 to 62,000 deaths each year. We had about 45 million total cases in 2017 with about 62,000 deaths, or a 0.13 chance of death from flu in the United States. As you know, our other numbers were 0.02. So the lethality of COVID-19 is much less. Now you've got hotbeds of it in New York, but again, we went over the numbers, 0.1% chance of death. Widespread, small amount of deaths. It's similar to flu, as a matter of fact. If we follow the science, as we've been asked to do, I'm following the science. This data is generated by the CDC, World Health Organization. The testing is generated by what we have done here. So we are following the science.